Once you enter the web app, you will find the new evidence-based taping app here. There are a number of short videos that can be used for your students to learn about the principles of taping, including the history of taping, clinical reasoning for the application of tape, considerations related to infection control, tape reactivity, and the contraindications and precautions of taping. These are all videos that can be linked to from your syllabus or your learning management system. This will then include application principles, skin preparation, optimal positioning, cutting and tearing techniques, how to apply and remove the tape, as well as post-taping precautions and care. Finally, there's patient education. What are the kinds of things that clinicians should tell their patients? A consent form and how to use and inform consent for taping. You can then move into the materials, in which there's an overview of the common different types of tape, as well as short informational videos about the different types and what they may be used for. To learn about specific taping techniques, you can now choose from different body regions. Let's start at the ankle and foot. You can see that the techniques are sorted by all conditions, so they can be related to conditions or related to different types of impairments. It can also be sorted by purpose, external support, facilitation, or edema control. So let's take a look at edema control and ankle swelling. And you can see that there are different tabs for information. So here under materials, you'll see the different types of tape, the scissors that you will need, a short educational video about how to measure the length of tape that you need.
Patient is supine with a foot in a relaxed position. Measure and cut first strip of elastic tape from the medial lower aspect of the tibia to the lateral ankle where the swelling is.
To learn about the actual taping technique, there is a narrated recording.
Patient is supine with the foot in a relaxed position. Tear the paper backing at the anchor.
You can also use the high-speed video, which is silent, to narrate over or to use as a quick review. When the tape job is complete, you can view the tape job from a 360-degree viewing angle. And you can use the gallery to observe the different steps of the tape job. You can then move on into the reassessment, which is a quick video of what can be done to determine the effectiveness of the tape job. There is a patient education component that includes the most commonly asked questions that patients might ask. How will this tape help me? What should I watch out for? When should I remove the tape? And even instructions on how to apply the tape to themselves if appropriate. This video that you see here can be mirrored for right leg or left leg and is an instructional video.
Relaxed position. Measure and cut first strip of elastic tape from the inner lower part of the shin bone to...
This all can be shared with the patient via the Share This Page email function. There you have it, a quick glimpse at the evidence-based taping app.